listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, help your clients get the coverage that's right for them this open enrollment period. We've got the ins and outs of how to prepare and prosper this OEP. Everything you need to know about the ACA OEP, written by Emily Ryan. The 2024 Marketplace Open Enrollment Period, OEP for short, runs from November 1st, 2023 to January 15th, 2024. This is a crucial time for your clients who are under 65 and in need of an Affordable Care Act or ACA health plan. We're covering some of the most important things to know before assisting clients with finding coverage this OEP. To determine what kind of coverage will work best for your client, start by collecting their demographic details. Information such as household income, the number of members applying for coverage, and the gender and ages of all applicants is necessary to evaluate all plan options. The Marketplace application also asks for this information, so you'll need it to fill out the application anyway. Household income will determine whether your client is eligible for premium tax credits or subsidies. Legislation such as the Inflation Reduction Act, or IRA, has influenced who is eligible for subsidies and for how long. You can read our report on the state of the Affordable Care Act market to find out if your client qualifies. The number of applicants is important to note if you have more than one individual signing up for coverage. As their agent, you're required to provide information regarding all children who reside in the household, even if they make enough money to file their own tax return. Anyone who is included on your client's tax return as a dependent, even if they don't reside in the same household, and anyone else under 21 who resides in the home. Also important to note, thanks to the 2022 finalized rule fixing the family glitch, more people now qualify for subsidized ACA coverage. You can learn more by reading the Ritter blog post linked in the episode notes. Additionally, where your client lives can affect what health coverage they are eligible for. For example, some states have their own exchanges, and others participate in the federal exchange. Become familiar with the right exchange for your client to identify where they need to register for coverage. Gathering this basic information is the first step to accessing affordable healthcare options for your clients who need them the most. Once you have gathered your client's demographic information and become proficient in the right exchange, it's time to find providers available in your client's area. It's important to understand which major hospital systems operate in your client's area. It can be helpful to learn which carriers participate with which hospital systems. You can find which hospital systems are active in your client's area by searching carrier websites for specific providers. If using an enrollment platform, such as Health Sherpa, you can follow the direct links to the carrier's page to utilize their provider search tool. Currently, Health Sherpa is only available for states participating in the federal exchange. Many state-based marketplace enrollment sites will allow you to access provider search tools as well. Take a look at the notes for more information about simplifying marketplace enrollments with Health Sherpa. Moving forward, we recommend searching for hospital systems for each client. Consider their preferences or specific health needs when identifying the carrier and network that's right for them.
Make sure you communicate with your client throughout this process to ensure that their needs are being met. If your client has a current primary care provider, or PCP, that participates in a plan's network, consider that carrier for their marketplace coverage. Next, what plan options are available for your client? Insurance carriers offer many different types of ACA plans. There are 3 different plan types regarding provider networks: Health Maintenance Organization, or HMO, Preferred Provider Organization, or PPO for short, and Exclusive Provider Organization, or EPO. Health Maintenance Organization and Exclusive Provider Organization plans limit coverage to a local network of physicians and facilities, and typically will not cover out-of-network care, except for emergency services. Preferred Provider Organization plans have a larger medical provider network and will cover costs out of network, but for a higher premium. Let's look at some of the key differences between HMO, PPO, and EPO plans. Health Maintenance Organization plans have a small local network. The out-of-network coverage is for emergencies only. An HMO has the lowest monthly premium cost with limited flexibility. EPO plans offer a local medium-sized network. Like HMOs, exclusive provider organizations only have out-of-network coverage for emergencies. The flexibility and monthly premium cost are both moderate in comparison. Lastly, we have PPO. This plan type has the largest network compared to HMO and EPO. Out-of-network care is covered with an added cost. Preferred provider organizations have the highest monthly premium cost and offer high network flexibility. HMO plans require a referral from a PCP in order to see a specialist, while PPOs and EPOs do not. Because of this, some individuals may choose an EPO or PPO plan for added flexibility. However, these more flexible plans are also more expensive. Consider both flexibility in network and affordability when your client is choosing a plan. In addition to the 3 plan types, there are 4 metal tiers: bronze, silver, gold, and platinum. These tiers separate how medical costs are shared between the policy and the beneficiary. The levels do not describe the quality of care or the services that are covered by the insurance provider. We'll give you an overview of the basic structure of the 4 metal tiers, starting out with bronze. On this tier, 60% of medical costs are paid by the policy. The remaining 40% is paid by the policyholder. Out of all 4 metal tiers, bronze has the lowest monthly premium. It also has the highest unsubsidized annual deductible comparative cost. This tier is not eligible to apply for a cost-sharing reduction. However, the bronze tier is eligible to apply for a premium tax credit. Next is silver. 70% of the medical costs are paid by the policy in a silver plan. The policyholder is responsible for the remaining 30%. The silver tier has a moderately priced monthly premium compared to the other 4 plan types. It also has a moderate unsubsidized annual deductible comparative cost. Silver is eligible to apply for a premium tax credit and cost-sharing reduction. Third on our list is gold. This tier of policy covers 80% of medical costs, and then the policyholder is responsible for the remaining 20%. The gold tier's monthly premium is high in comparison to bronze and silver. It has a low unsubsidized annual deductible comparative cost and is not eligible to apply for a cost-sharing reduction. The Gold tier is eligible to apply for a premium tax credit. Lastly is Platinum. On this tier, 90% of medical costs are paid by the policy. The remaining 10% is paid by the policy holder. Of all 4 tiers, Platinum has the highest monthly premium and the lowest unsubsidized annual deductible comparative cost. This tier is not eligible to apply for cost-sharing reduction. However, the Platinum tier is eligible to apply for a premium tax credit. As you just heard, as the metal tiers go up, a member's coinsurance responsibility goes down, while the plan's coinsurance responsibility goes up. The most prevalent tier in the marketplace is Silver because clients can apply a premium tax credit to reduce their cost. Once the plan is picked out, your clients may ask when coverage will begin. In order for coverage to begin, help your clients successfully complete their application and then direct them to pay the first monthly premium. Here's how your clients can make that payment. Step 1, log into healthcare.gov. Step 2, select the application under Your Existing Applications. Step 3, click the blue button that says Pay Your First Health Insurance Monthly Premium. Step 4, if online payment is available, select the green button Pay for Health Plan Now to go to the insurance company's website to pay. Some insurance companies do not participate in online payment. In this situation, the carrier will contact your client about the next steps. For health plans that were signed up for during the beginning of the open enrollment period, most coverage will begin January 1st, 2024. For plans that were sold between December 16th and January 15th, the coverage will be effective February 1st, 2024. Effective dates can vary between exchanges. For example, some states may have an extended OEP, allowing a client to enroll in ACA coverage as late as January 31st and have an effective date of March 1st. Ensure the correct effective date for your client based on the corresponding exchange and plan and advise them when their coverage will begin. Verify that your client's coverage is active by signing into healthcare.gov and checking under My Plans and Programs. Now, we understand that life happens. Situations arise and deadlines are missed. There could be a multitude of reasons a client misses the OEP. If you and your client miss the open enrollment period, there could be other options to access affordable healthcare through the marketplace. In case of significant changes, your client may be eligible for a special enrollment period, or SEP for short. Life changes, such as having a baby, changes in residence, or loss of health insurance will qualify an individual for an SEP to enroll in a marketplace insurance plan. An SEP is the only way to register for marketplace coverage outside of the OEP. Verify that the application information is correct, including the information that qualifies your client for an SEP. Your client may be asked to provide additional documentation to confirm eligibility based on the life event experienced. If your client is not eligible for an SEP but still requires healthcare coverage, consider a short-term medical policy where available. This is an option for clients that can pass health underwriting to get coverage until the next enrollment period. These plans are not ACA compliant, but they are an excellent option to have available in your portfolio for the clients who need them. The OEP is a crucial time for your clients under 65 who are looking to sign up for a marketplace plan. They're counting on you to guide them through the process. These essentials will allow you to prepare your clients for enrolling in their new marketplace insurance plan. Here at Ritter Insurance Marketing, we have many in-house tools to assist agents with daily tasks. If you haven't already, register with Ritter to gain access to these tools, like the Ritter platform, custom marketing materials for your business, webinars, and training. You can find the link to register in the episode notes. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Emily Ryan. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.